your health tonight. The changes ahead in health care. There's a lot of uncertainty in Washington about the Affordable Care Act. President Trump wants it gone, but what's going to take its place? News 4's Jen Sean spoke to a handful of experts. She joins us live. Jen?
Alina, I spoke to 4 different policy experts, both from liberal and conservative organizations. A straight-up repeal, they say, would be detrimental. And a lot of the ideas floating around as replacements seem theoretically possible, but they're convinced it won't be that easy. Ousting the Affordable Care Act is high on the agenda for the first 100 days of Donald Trump's presidency.
The platitude that we hear of we don't want people to lose coverage, we don't want people with pre-existing conditions to be turned away. So those are things that people keep saying over and over again, but until we actually see a plan or the plan, it's really hard to know.
Conservative and liberal health policy experts agree that the ACA has flaws. It's also provided more coverage for more Americans.
There are about 93,000 people in Erie County who stand to lose their health insurance, and there are about 21,000 in Niagara County.
You could see more people lose insurance than gained it under the Affordable Care Act.
Dr. Nancy Nielsen with the Jacobs School of Medicine and Biomedical Sciences at UB anticipates Congress will work to repair as opposed to ousting it completely.
My prediction is you're going to see a rebranding.
Compared to other states, New York is facing less of an impact from a repeal, she says. Still, the uncertainty of what comes next has caused an enrollment spike in the state's exchange. President Trump has promised health insurance that's better and cheaper. One group that may need more convincing is veterans, who often get their coverage from multiple places.
Many have gotten coverage through the Affordable Care Act or Obamacare. If that's repealed, they're more likely to have to rely upon the VA, and we've heard too many stories about lengthy waiting times, the lack of capacity at the VA.
And of course, that federal hiring freeze impacts the VA. Health coverage for this year really shouldn't be impacted much, Dr. Nielsen says, but it's 2018 that things will start shifting. Still, she says if you haven't enrolled yet, you should do it now. Reporting live in the studio, Jen Shantz, News 4 at 5:30. Nalina?
Jen, thank you so much.